So that's a basic summary about KRAS lung cancer. It's the most common subtype of non-small cell lung cancer. We now have an FDA-approved medicine specifically targeting KRAS, the mutant form of the protein, keeping it in the off state, called sotorasib, for individuals who have KRAS G12C lung cancer. And there's many more medicines targeted different KRAS mutations entering clinical trials. And then the other thing to know is that this is detected via a biopsy, and it can be the traditional biopsy or a ctDNA test called liquid biopsy. All right, next slide. So I'm going to talk a little bit about the treatment strategies for KRAS lung cancer as a general overview, and I'm happy to discuss more details at the Q&A. So when I think about lung cancer treatment, I think of it in two different categories. So along the top, along the top are medicines that are called systemic therapies. So they're medicines that go everywhere in the body. And these are classified as traditional chemotherapies, which are medicines that target all dividing cells. Targeted therapy, which is similar to sotorasib, a medicine that just goes off against the mutated cells that have the mutated form of the protein. And immunotherapy, which essentially boosts your immune system to go after the cancer cells. There's also localized treatments along the bottom, which include surgery and radiation being the most common types. And then the other thing to not forget about is symptom-directed therapy. So if someone were to have a cough or constipation, there's medicines directed at that. Next slide. And to speak a little bit about treatments, systemic treatments for KRAS lung cancer, I've listed the most common treatments that someone might encounter in each of these categories. So there's several forms of IV chemotherapy that might be given either by itself or combined with one of the other chemotherapies listed on this column. And those are usually given once on like a weekly, and every other week, and every 3 week, or every 4 week schedule. So those are medicines that are able to shrink KRAS-driven lung cancer. The middle section, the targeted therapy, which now we have sotorasib, our first KRAS G12C targeted pill. We also have these two other IV medicines that target blood vessel growth that sometimes are given in KRAS lung cancer. And finally, KRAS lung cancer does respond to immunotherapy. And so there's several immunotherapies that might also be given for KRAS lung cancer. And then on the far right, there are actually many clinical trials out there. This is probably one of the hottest fields in lung cancer right now. And so clinical trials are an option for individuals who are interested in trying something new or different, something that hasn't been tried and true, but has very promising evidence in the laboratory that it'll be helpful for people. And so there's various clinical trials that are available for KRAS lung cancer as well. Next slide. And finally, I want to emphasize that it's not just about shrinking the tumor, but also there's a lot of, it's important to not forget about both mental health, which significantly affects physical health. So I talk to all of my patients about trying to exercise regularly, developing a support network, knowing who your support network is, and then trying to maintain a routine if possible during this period of time. I think this is very important, and I see Terry is smiling and nodding. So I always want to emphasize this point. All right, last slide. So this slide just gives you a glimpse of all these. There's many KRAS G12C drugs that are also being investigated both by themselves and in combination. But I just want to give a preview of what's coming on board. And this was just a list that I came up with of all the new medicines that are about to get started in clinical trials of KRAS non-G12C lung cancers. And You can see KRAS G12D, 13CV. There's all these KRAS multi or pan-RAS inhibitors, so medicines that target other subtypes of KRAS lung cancer. And I've just color-coded them based on the many different ways that we're thinking about targeting KRAS lung cancer. So not just a sotorasib-like approach, but other completely different medicines that include those that induce new protein-protein interactions, activate the immune system. And so this is a very exciting and bright field, and we're very excited for the next years to come of developing new effective medicines for KRAS lung cancer. So final slide. So I just want to summarize, there are many, many potential treatment options for people with KRAS lung cancer that medical oncologists will speak to you about, and this includes several categories of systemic treatments, including our first targeted therapy in KRAS G12C lung cancer. There are locally directed treatments, and then to remind you at the very end that there's many new treatments that are being developed in clinical trials for individuals with KRAS lung cancer. All right, next slide. So I thank you very much for your attention, and I'm happy to take any questions at the end and during the Q&A.